Welcome to the BioBalance Healthcast, episode number 402, Low-Dose Naltrexone and Depression.
BioBalance Healthcast features conversations about positive aging. Your hosts are Dr. Kathy Maupin, Medical Director of BioBalance Health and a leading expert in treating symptoms of aging, and Brett Newcomb, a licensed professional counselor. Dr. Maupin and Brett are the authors of The Secret Female Hormone, the seminal work about hormone replacement therapy for women, which is available on Amazon or from Dr. Maupin's office at BioBalance Health. Dr. Maupin's office is currently accepting new patients.
So, many of you may have heard of a drug called Narcan, which is naloxone. It's the cousin of naltrexone, that emergency responders carry around with them today in America's world, because they encounter so many people that have overdosed from opioids. And if they get them in time, they can inject them with a surge of naloxone, which will cause the opioid receptor sites in their brain to stop working so that their heartbeat and breathing respiration centers can come back. And they can save them if they get them in time from an opioid overdose that otherwise would have killed them. We're not talking about that. It is an opioid antagonist. We're talking about its cousin, which is a similar drug called naltrexone, and it's prescribed primarily in low-dose amounts. You take it generally at night in a small amount, and it blocks your opioid receptors in your brain while you sleep, which causes your brain to get a signal that says, hey, we need to make more of our own innate, intrinsic opioids.
Endorphins.
Endorphin, which lead to endorphin production, so that when you wake up the next morning, you have more energy, you're less depressed,
you're not in
more
pain.
alert and aware and ready to go. And so often it's given in tandem with, it's given, low-dose naltrexone is given with an antidepressant. If you are severely or clinically depressed and you're taking an antidepressant, your physician may want to look at adding a low-dose naltrexone to your antidepressant prescription, which chemically changes the structures. It helps you reduce or avoid addictions, and it helps fight depression. One cause of which, and we'll go into that in a moment, is inflammation. And it has to do with two things that we're now learning to focus on that in the historic treatments of depression, most of us weren't aware of, didn't know what to do with. And that is the receptor sites in the brain. We've not focused on receptor sites as much as we are now beginning to. And I'm blanking on the other one.
Reception. The production of
the production of neurotransmitters like serotonin and norepinephrine.
So we used to always just look at depression like you're depressed. Like it's one thing.
You got it again?
You got it again. Yeah, you're depressed. And so we're going to throw some medicines at it.
And it comes in cycles.
Yeah.
If you have it, you're going to have it all your life in cycles.
But there wasn't a lot of choice in terms of medication, but now there's a lot more choices.
Right.
And I think the pharmaceutical companies are ahead of us in our training